Thank you for this opportunity to speak in support of legislation to prevent gun violence. My name is Dr. Rachel Payne, and I am a trauma surgeon and the Associate Trauma Medical Director at Hennepin County Medical Center, Minnesota's largest and busiest trauma center, where I've spent the last decade caring for injured patients from all over the state. Among those injuries are hundreds of victims of gun violence. I've responded to many mass casualty incidents, most recently 2 of them within 24 hours of each other this month, both for mass shootings. On the morning of the Annunciation shooting, I had already been at work on trauma call for about 27 hours, during which I'd cared for mass shootings victims from South Minneapolis from the afternoon before. I'd spent the day and night operating on patients with life-threatening injuries in their chest and abdomen, providing critical care for others with life-altering facial and extremity injuries. Overnight, patients continued to be injured by guns, including one we were unable to save, despite heroic measures including opening his chest, trying to make his heart beat and stop the bleeding, while my emergency department colleagues poured blood into him. But he was already gone. Before I could even begin to process that 24 hours and the first mass shooting, another mass casualty alert sounded. I headed straight to the emergency department, where I was joined by fellow trauma surgeons, many of our resident doctors, emergency doctors, nurses, and everyone buzzing around already the trauma bays to receive what we were told as many as 20 injured children. The first wave arrived, 5 or 6 kids at once, some of them in stunned silence, some of them screaming, terrified that the shooter was still after them and could get them even in the hospital, others unconscious from their injuries, all of them bleeding and all of them permanently traumatized. My partners and I quickly determined who needed the operating room the most critically, and a couple of my partners began operating on some children that had been shot in the torso. All of their vital organs would have to be thoroughly surveyed. Bullets ricochet within the body. Some of the larger ammo can disperse into dozens of metal fragments on impact and scatter within the body cavity. They enter their target with such heat and force that they create blast injury in their wake far beyond the holes we can easily see from the bullet, which is why we have to carefully scrutinize every organ and blood vessel, and why the damage from gunshot wounds is so uniquely devastating and can sometimes not be repaired even when they get to us in time. While my partners worked, I went to the control desk at the operating room to help coordinate remaining surgeons, operating rooms, and operating room staff to ensure that we could treat every child with the urgency and expertise they deserved. I evaluated every single child that came through our operating room that day as they came by the desk. I am haunted by the looks in their eyes. The looks of horror, as if their sense of safety in childhood had just been snuffed out in seconds. Thank you. Then the influx of phone calls from the panicked parents came in, desperate to know if their child was going to live, if we had them there with us. Most of them we couldn't immediately give answers to, and they had to wait in anguish while multiple surgeons worked. I will never forget the agony in those parents' voices. But these victims, their loved ones, the community, and everyone who cares for them has experienced no human being should have to suffer. In the wake of these major tragedies affecting our teams, we all have to go back to work the next morning, and we're all looking for ways to process this. And I've never had a satisfying answer for team members that have asked how to cope with the devastation we witness in events like this. But it does help to tell our stories to those of you who are empowered to prevent this from happening again. I urge you to pass meaningful legislation that limits access to the weapons designed for the most maximum permanent damage to human life. I implore you to pass legislation that saves lives and protects families from senseless violence. Thank you.
Thank you, Dr. Payne. And while Dr. Weigert is testifying, if Dr. Tim Kummer will come forward, please. Dr. Weigert.
Thank you. Chair Latz and committee members, my name is Dr. Rachel Weigert. I am a mother, a pediatric emergency medicine physician, and gun violence prevention researcher, and I'm here today in full support of the bills before you. I was working in the emergency department at Children's Minnesota on the day of the Annunciation shooting. As a level 1 pediatric trauma center, Our staff train regularly to be able to respond to these kinds of tragic events. We had just 5 minutes to prepare to care for 5 gunshot victims that were en route to our hospital. Our department, similar to Hennepin, immediately mobilized with over 50 additional staff, including a skilled team of pediatric specialized surgeons, neurosurgeons, anesthesiologists, emergency room physicians, nurses, child life specialists, and others to provide the complex care required for children with gunshot wounds. I am grateful to my colleagues at Hennepin Healthcare because they, of course, were preparing to do the same. Due to the smaller nature of children's bodies, a single bullet can do an incredible amount of damage. A bullet from an automatic rifle is designed to splinter into dozens of twisted metal shards, which can instantly kill a child due to critical organ and blood vessel damage. That is how Fletcher and Harper were murdered in their church that morning. The effect of gun violence compounds when taking into effect the emotional toll on everyone involved. Children require gentle and careful handling after a traumatic event, and especially when they are separated from their parents. My colleagues and I provide this nuanced care to children every day, and it was especially needed on August 27th. On the day of the Annunciation shooting, I cared for a child with bullet fragments in her arm and leg, and she told me she had likely sustained those injuries while protecting younger students by laying on top of them. I cared for another child who took a bullet to the back while shielding his friend. It ripped through his kidney. The common theme I heard from the kids that day was, "I know what to do because we train for this." While I'm in awe of these students' bravery, I am similarly devastated by the fact that we live in a society where we have asked this of our children and educators, to prepare with militaristic precision for the inevitability that they will be targeted and potentially murdered in their own school. In the emergency department, when we recommend different medical treatment than what a patient's family believes to be best, I have found it extremely useful to focus back on our common interest, the health and safety of their child. We should think about the contentious conversation around guns in the same way. Strong, entrenched feelings abound, and we need to refocus on our common goal: the life, liberty, and pursuit of happiness of our community members, each of whom you have the heavy and impactful burden of carrying. In addition to all of us here today, your packets include a letter signed by over 60 kid-focused organizations, including Children's Minnesota. This letter stresses the dire urgency of the moment we are in and pleads for your action. My children, your children, and any child that calls Minnesota home deserves to know that they can stay alive and safe from gun violence, whether at home, school, church, or anywhere in their community. Passing this bill is a critical step in making that happen. Thank you, Senator Mohammed, for your leadership.
Thank you, Dr. Weigert. Dr. Kummer.
Mr. Chair, good morning. Madam Chair, good morning. Thank you for the opportunity. My name is Dr. Tim Kummer. I'm an Assistant Medical Director of Hennepin EMS and an emergency physician at Hennepin Healthcare. I was the first physician on scene at the Annunciation School shooting. When I arrived, I joined our paramedics in assessing children who had been shot in the back, in the arms, in the head. As we took in the immense pain and fear in those children's eyes, we tried to comfort them as they were rushed to the hospital. Once all critical patients had been transported, our focus shifted to the children who said they were uninjured despite having blood on their clothes. We had to confirm that the blood on them was not from their own wounds, but from the classmates they had tried to shield. At the same time, we began the reunification process, matching parents to their children, which included the painful task of telling some parents their child had been shot and was at the hospital. Finally, we carried out the devastating task of telling parents their child had been killed while singing in church during the first week of school. I've seen many difficult things in my career, but what I witnessed that morning was unlike anything else. I saw the horror in the eyes of innocent children, the fear of parents desperate to know if their child was alive, and I heard the screams of mothers and fathers when they were told Their child had been murdered. I still see those faces when I close my eyes, and I hear their voices when I try to go to sleep. But gun violence is nothing new to our communities. The Black and brown communities we serve have lived with this painful reality for decades. It angers me that it took a church full of children for us to gather here today. And yet, even now, you debate if you should act. I don't know if or what I could have done differently that day, but I do know this. The level of chaos and the depth of suffering was because of the type of weapon used. At Annunciation, the shooter fired more than 100 rounds with a high-powered rifle. That is why there were so many victims. That is why the injuries were so severe. The type of gun matters. At Annunciation, I cared for a 12-year-old girl who had what looked like a very small graze wound to the top of her head, an abrasion, nothing else. But despite that bullet never entering her brain, the energy from the rifle was so powerful it caused severe bleeding in her brain, and she had to have part of her skull removed. From a handgun, that wound would likely have only been a graze wound. But from a high-powered rifle, it became a life-threatening brain injury. Assault rifles turn survivable injuries into fatal ones. They turn small tragedies into mass tragedies. I know some will say that most gun violence involves handguns, not high-powered rifles. And that might be true. But in an event like Annunciation, the rifle made everything worse. It turned potentially minor wounds into life-threatening ones. It multiplied the number of children shot, and it amplified the trauma for families, for first responders, and for healthcare providers. I am not a gun expert, but I am an expert in the aftermath. The suffering these weapons inflict and the PTSD they leave with my colleagues and me. I see firsthand how the type of gun determines the destruction. Not banning these weapons compounds our suffering. For victims, for families, for first responders, and for healthcare providers, your inaction is not neutral. Your inaction is acceptance. You have the power to save lives and to decrease suffering. Please take meaningful action and swift action to limit access to weapons designed for maximum and permanent damage to life. Thank you.
Thank you, Dr. Coomer.